Thank you very much. And I giving the call to the member for Lyne.
Thank you, Madam Deputy Speaker. Look, this topic is very sensitive to everyone in Australia because health is so important to everyone. At some stage in your life, everyone needs to end up in a hospital or at a doctor's surgery. So there's so much emotion attached to an argument about health. But we'll try and restrict it to the facts. And I just want to point out some of the hypocrisy that's coming towards us from the other side. Now, first of all, the member for Lyne so elegantly outlined the bulk billing rebate. At the time that pathologists are running a scare campaign saying that we're cutting bulk billing, it's really quite misleading. The bulk billing itself is not being cut, but the incentive to the pathology company that doesn't go to the patient is being cut because it didn't achieve what it was meant to do. It was meant to increase bulk billing, but over 5 years it's hardly budged. So that's a figure of $1.40 to $3.40. Now, as has recently been tabled, some documents for a publicly listed company show a healthy profit margin and an increase in the last 6 months. And also, the ability to cherry-pick knows no bounds from the other side. They miss the big picture. In a health budget, it's not just a pathology bulk billing incentive that counts, it's things like drugs. Look at all the new hepatitis C drugs that are available for patients, courtesy of sound financial management. Look at all the new cancer drugs. Look at all the biologicals that are coming down on stream. People forget about the pharmaceutical benefit scheme. That has to be paid by something. Everyone on the other side seems to cherry-pick any remote linguistic twist to put a cut on the table, whereas really health funding has gone up to record levels under this coalition government. Now, the state funding agreements for hospitals has gone up over the forward estimates in the next couple of years to the tune of several more billion. That is not a reduction. That's also part of the health budget. Look at what we've been doing with the primary health networks. Primary health networks were very dysfunctional. There was the odd one that was really delivering some runs, but it's been restructured and they've got clear KPIs and they've got a clear target of what to do. They're not going to just duplicate existing general practice services or what existing providers, whether they're public hospitals or private practitioners. They've got to meet targets. Also, our initiatives in chronic disease management. Chronic disease costs so much to the health budget. It's the old adage of 15% of the patients cause 85% of the costs. That's the nature of it. Most of the health spending that we Australians all receive is at the tail end of our life. If most of us remain healthy, that's the logical conclusion. But chronic disease, like whether kidney failure or diabetes or heart disease or vascular disease, chronic lung disease, those recurrent spending ones are a real burden on the individual's life, but economically they are the best area to target for savings and efficiencies. So having a healthcare home, rather than having patients shop around to wherever it's convenient at the time, you get all your chronic disease focused into one practice, and that's going to mean 65,000 patients in a trial that costs 200 medical practices will get a system in place that works for the patient and also works for the economic bottom line. Now, there's criticism about so-called rebates, but really it was incentive payments. But I notice the member for Sydney's here to debate this topic, but when she was the Minister for Health, she introduced an MBS freeze. The member for Ballarat actually belled the cat on Sky News on the 22nd of February 2015. She said the opposition would be kidding itself if it didn't recognise there were challenges. There is no area in the budget that is going to be exempt. So we're already on the front foot addressing this. That's why the Medicare benefit schedule review is underway. And look at what we've announced in the health portfolio with the child and adult public dental scheme. That's an increase up to $2.1 billion, to provide infrastructure in public hospitals in regional and remote Australia and to actually deliver what the previous schemes hadn't delivered.